Anybody who has used opioid use disorders will tell you that I've gone through every treatment you can think of. I had been in residential facilities for 30 days, 60 days. I got out and I used again. I've been in all sorts of treatments. So why is it different this time? The difference is that we have now identified that medications along with psychosocial treatments do improve the chance of decreased relapse and recovery. It is a new way of thinking about the treatment of opioid use disorder.
So what we hear frequently when folks are trying to get into treatment is, I've called, no one has an opening, I'm waiting, I get put on wait lists. Please be your own advocate. You need to advocate for yourself. Continue to call, don't give up. Call every provider that is available to you. Eventually, you will see success.
And then on December 26th, I started outpatient treatment because even though I was serious, I really did want to get sober. At that point, I couldn't imagine myself not using the drugs because I knew, one, I was going to be sick, and I didn't want to be sick because it's just horrible. And I had been doing the drugs so long, and I was already 45 years old, that I didn't know, if as old as I was at that point, if I was really even going to be able to stop.
She told me that, yeah, you just take it and you don't feel dope sick at all. And I'm like, yeah, right. It said, really? You take a pill and you don't feel dope sick. It takes all the sickness away. And unless you have been through withdrawals, you won't know what I'm talking about, but it is, you can't believe it. I didn't.
So at the present time, we have 3 medications that have been approved by the FDA for treatment of opioid use disorders. So opioid use disorders means the body is needing opioids, either heroin or opioid pills, in order to function. The first medication is methadone. This has been available for a very, very long time. The second medication is buprenorphine. It's also known as Subutex or Suboxone. And the third medication is naltrexone, or otherwise known as Vivitrol, which could be available as a pill or could be a long-acting shot.
Methadone was like a perfect choice for me. It was, it worked. It was the it thing for me. It was a medicine that was monitored. It was taken every day. I actually was excited to get up and go take it, knowing that I had the opportunity to get it right, to start over. You know, that I was even still living, to take methadone to do better. It gave me opportunity. It helped me to become a better mother.
I got on Suboxone, and it's a sublingual, bilingual, you have to let it, a sublingual tablet, you have to put it under your tongue and let it dissolve. And it does, they find the dose that you use so you don't get sick. And then you climb up, they adjust it. It takes about a week, but then you find where you're at, and that's where you stay at.
I just know that all treatment is not the same. I didn't know that most people, especially my son, he had a couple issues. And if you're just going to treat the heroin addiction, you're failing on other things that was wrong with him, whether it be bipolar, whether it be depression. You have to find the treatment center that is right for you or your child. Just because it's, you know, the coolest place, California, to go doesn't mean it's going to do what you need it to do. You need to cross-reference, make sure what they say they need to do with your child is there.
So our goal with medications is to not only address those withdrawal symptoms and that uncomfortability that comes from withdrawal, but also then to quiet the cravings. Once we can quiet the cravings and that incessant voice saying, I need to use, I need to use, I need to use, we can start addressing through psychosocial therapy all of the other issues that come with the addiction. So at that point, a client would then meet with an individual counselor, start talking about individual issues, things that have maybe precipitated the use, but also things that we can put in place and supports that can be put in place to aid in ongoing recovery. So in addition to addressing both the substance use disorder, we would also be addressing any other issues that might be present. We can provide some family services, some family counseling, some couples counseling. We can provide some social supports through peer mentoring services.
The road to recovery is not easy. There are so many times it's an up and down road. It's not one straight road. Individuals typically state that it takes multiple years before they can reach the road of recovery. Medications are the first step. They stop with withdrawal and they cut down the craving, which often are the barriers in stopping patients from engaging in long-term treatment and reaching recovery.
I use the example of if you were a diabetic, would you be ashamed to be taking insulin? And I approach it from the standpoint, diabetes is your condition, insulin is the medication to manage that. Opioid dependency or drug dependency is your condition. We have medication to help you overcome that.
So this time around, I got on Suboxone September 30th of 2015, and this time, I actually wanted to get off heroin, so I kind of approached it a little differently than any other time. I would, before I would get on it and I would get taken off and go right back to what I was doing before, but this time, I got on it, and when they started to try and get me to wean off of it or taper off, I refused, and kind of, the doctor I had was a doctor I've dealt with for years, and he's seen my pattern, and he's seen that every time that I was taken off my medication that it ended in a relapse and back in treatment. So this time we decided to not come off of it, and yeah, that was about 2.5 years ago. So, Suboxone was it played a crucial role in why I'm still here today, clean and sober.
So since I've been on the Suboxone the last couple of years, my life has changed immensely. I mean, I'm coming up on 5 years clean, and I did not think in 5 years my life would be as wonderful as it is.
Key thing is being an advocate for yourself, being advocate for your personal health, be an advocate while you're on the program, be an advocate before you get on the program. Be persistent in this area. Communicate with the people that can help you. Nobody will know unless you speak up. It's your responsibility to do so.
After asking around, because I knew that it was something better than this life, I knew that it had to be some type of help. But I really had to dig, because if people weren't looking for help, they really didn't have the information for help, I went to several hospitals, and I gave them a story as if it was just a friend using, and they kind of gave me direction. They would tell me that it was a treatment center here, or you have the option to take this medicine or this medicine, whatever works for you. But I do feel as though had I known in maybe the first 2 months of me using, my journey wouldn't have been as long, and had I known that people really do care, they really, they care that you're on the drug and that you want help. They don't downplay you or anything. But had I known that, things would have been a lot different.
There's a solution, we do recover, and for me, it was through Suboxone coupled with 12-step recovery.
When you're not on drugs or anything, you start thinking, and you think normally. And again, I say it's with my religious beliefs. I'm trying to be and walk like a Christian, that I want to do right now. I want to be law-abiding. I want to be a productive member of society. Okay, you could say that, but you want to be that. Suboxone helps because I have a clear mind, and my thought process now is not to get dope; it is to do right.
Today I have friends. Today I have people that actually call me because they care about me and want to talk to me. Today I'm a good employee. I'm trusted. You know, I have keys to things. I have keys to buildings. You know, I have money in the bank. I have a driver's license. I have insurance. You know, all these things. I don't have to steal for my next meal. I don't have to steal for my next fix so I'm not sick. You know, I get up and go to work every day.
My life today is completely different than it's ever been. All I've known since I was a teenager was, you know, the getting and doing drugs. That's all I knew. You know, today I have a career, you know, I work, I have a house, I have a vehicle, I have, you know, a relationship, and we have, you know, I have a child on the way. I mean, this, you know, this life is something I would have never dreamt of.
Please join us in our efforts to improve people's lives, not just improve lives, but to save lives, and to help people get into meaningful and long-lasting recovery.